behind all the glitz, glam, and diamonds lies a darker truth about housewives' beauty, where plastic surgery dreams often turn into nightmares. Brandi Glanville once claimed a parasite attacked her face, while Tamra Judge's skin nearly melted from a chemical reaction. And that's just the beginning. These are the most shocking Real Housewives cosmetic disasters. Brandi's approach to cosmetic procedures can best be summed up as, give me one of everything. The outspoken reality star has openly admitted to breast augmentation, vaginal rejuvenation, endless Botox, and countless fillers. When RuPaul once asked what facial work she'd had done, she laughed and said, tons. She wasn't exaggerating, she's confessed to being overfilled, suffering bad Botox that caused droopy eyes, a condition known as ptosis, and even trying laser lipo on her stomach after people kept asking if she was pregnant. Then came the shocking twist. In 2024, Brandi disappeared from social media for over a year before returning with an unfiltered photo that stunned fans. Many assumed it was another case of botched cosmetic work, but Brandi claimed otherwise. According to her, some doctors believe she's suffering from a parasite that moves around her face.
I have a parasite that jumps around my face. It lives in the skin in my face. It'll go and jump around to different places and just get lumpy in all the different places.
Some say Brandi Glanville's mysterious facial swelling comes from a parasite, but others believe it's angioedema, stress-induced swelling that can trigger anaphylactic shock. Brandi spent nearly everything trying to find answers. Her own theory? She blames Bravo and the legal chaos she's faced, from sexual harassment allegations to lawsuits involving Andy Cohen. She claims the stress literally destroyed her face and health. Once obsessed with changing her looks by choice, Brandi now says something out of her control is changing it for her. Tamra Judge's story is another cautionary tale. In 2024, she decided to celebrate her birthday with a few touch-ups, expecting a refreshed, younger look. Instead, she ended up documenting what looked like a medical nightmare. Tamra's cosmetic journey began years earlier with a smooth, lower facelift in 2017, which boosted her confidence in surgery. She later had her breast implants removed in 2021, feeling happier and more natural. But by 2024, she felt the top half of her face didn't match the rest, so she decided to finish the job, a move she'd soon regret. Her mistake? Combining too many harsh procedures at once, a surgical brow lift, CO2 laser treatment, and a blue chemical peel. The result was catastrophic. Tamra's face became painfully swollen, bruised, and tinted blue. She could barely open her eyes, speak, or eat, describing the pain as unbearable. When she shared photos online, fans were horrified. The swelling distorted her features so badly, she looked like she'd been in a serious accident. What was supposed to be a quick beauty boost turned into one of the most shocking cosmetic disasters in Housewives history. Marisol Patton holds the unfortunate title of having one of the worst cosmetic surgery journeys in Real Housewives history. Over the years, she's endured 6 different procedures, each one meant to fix the last, but only making things worse. Her story began as a teenager. Growing up with naturally large breasts during a time when smaller chests were seen as ideal, she felt uncomfortable and self-conscious. Hoping to fit in, she underwent breast reduction surgery at a young age. But instead of confidence, she was left with painful scars and a disfigured chest. The surgery was aggressive, and to make matters worse, Marisol's body wasn't done developing. Her breast tissue grew back over time, bringing her chest nearly to its original size, but now marked by permanent surgical scars. Frustrated and insecure, she tried another corrective surgery, which only made things worse. Desperate for normalcy, she turned to implants to restore volume and balance. That decision would haunt her. During one operation, an implant migrated toward her shoulder. Yes, literally moved out of place, and had to be surgically removed and reinserted. The repeated trauma caused massive scar tissue buildup, but her nightmare didn't stop there. One of her implants later popped, forcing yet another round of surgery. After years of failed corrections, Marisol was left with chronic pain, restricted movement, and deep emotional scars to match the physical ones. A devastating reminder of how far cosmetic surgery can spiral when things go wrong. Lauren Simon thought she was making a smart financial decision by traveling to Turkey for a breast augmentation. The package included surgery, luxury accommodations, and transport, all for a fraction of the UK price. Initially, the procedure seemed successful, but within days, her recovery turned into a nightmare. Her nipple turned black, she couldn't sleep, and a severe infection developed, causing tissue necrosis. The Turkish clinic abandoned her post-surgery, leaving Lauren to seek emergency care in the UK. Doctors were horrified at the substandard work and materials, and she needed multiple procedures to save her breast and prevent the infection from spreading. Lauren's experience highlights a terrifying reality. Overseas cosmetic surgeries can be extremely dangerous, with dozens of Britons having died from complications in recent years. Jennifer Aydin's story is particularly ironic. Married to a plastic surgeon, Dr. Bill Aydin, she would seem to have an advantage. Yet her cosmetic journey has been far from smooth. Her rhinoplasty succeeded, giving her the nose she wanted, but a chin implant went disastrously wrong. It looked unnatural and felt off, forcing a painful removal and leaving permanent scars. Even a later tummy tuck performed by her husband created an awkward dynamic, blurring personal and professional boundaries. Jennifer's story shows that even with access to expertise, cosmetic surgery carries risks, and emotional scars can linger long after physical recovery. Shannon Storm's Beador's battle against aging began innocently with facial fillers, giving her a subtle, youthful glow. But over time, the touch-ups escalated into visible overfilling, distorting her features. She underwent hyaluronidase injections to dissolve excess filler, then opted for a facelift. Unfortunately, she scheduled it just 5 weeks before filming the Real Housewives of Orange County reunion. Far too little time for proper healing. Fans and critics noticed lingering swelling, tightness, and other post-surgery effects, a stark reminder of the public pressure women face to maintain perfection. Dolores Catania's story started successfully but turned cautionary. 9 years prior, she had her first breast augmentation, which initially gave her confidence. Over time, the implants shifted, sagged, and sat unevenly, causing insecurity. Following Teresa Giudice's recommendation, Dolores chose the same surgeon and implants Teresa had used. While friend recommendations can influence choices, Dolores' experience underscores that what works for one person may not work for another. Anatomy, healing, and goals vary, making personal recommendations potentially misleading. Teddy Mellencamp's experience highlights a less discussed aspect of cosmetic surgery: its long-term impact on motherhood. After breast surgery, she became pregnant with her third child and discovered she could not breastfeed as expected. "I had absolutely no idea that this would affect anything," she admitted. Her story exposes gaps in patient education and informed consent. Many women undergo breast procedures without understanding how they can impact milk ducts, nipple sensation, or breastfeeding function. Teddy's experience emphasizes the importance of discussing future family plans with surgeons before any breast procedure. Lisa Rinna's lips have become one of her most recognizable features, but her cosmetic journey offers an important lesson in moderation. She began years ago with subtle lip filler enhancements, aiming to give her naturally thin lips a soft, natural boost. The early results were flattering and complemented her overall facial structure, giving her confidence and encouraging her to continue. Over time, however, her cosmetic routine expanded beyond her lips. She began receiving filler injections in her cheeks, temples, and other facial areas, along with regular Botox treatments to smooth lines and maintain a youthful appearance. The cumulative effect of these procedures gradually altered her features in ways she hadn't anticipated, making her look more exaggerated and less natural. Recognizing this, Lisa made the conscious decision to scale back, reducing both the frequency and amount of her treatments. By doing so, she restored balance to her face, maintaining her signature lips while avoiding an overfilled or artificial appearance. Her story highlights the importance of restraint and thoughtful planning in cosmetic enhancement. Teresa Giudice's extensive cosmetic history includes multiple breast augmentations, facial procedures, and regular fillers, but her most serious complication came from a routine tummy tuck. Intended to tighten skin and repair abdominal muscles, the procedure turned into a medical emergency, possibly due to infection, requiring prolonged care and delaying filming and public appearances. Despite this, Teresa continued pursuing cosmetic enhancements, demonstrating the psychological pull these procedures can have even after severe risks. The Real Housewives plastic surgery disasters prove that money can't buy perfection. The pursuit of youthful beauty sometimes creates damage far worse than natural aging. These women risked their health, spent fortunes, and endured complications requiring years of corrective procedures. Yet the most shocking stories are likely happening behind closed doors, with extreme procedures that make even the most notorious disasters look tame by comparison.